fireside chat, which focuses on a sector that is fundamental, to the country's growth and well-being. And this session is titled The New Frontiers of Healthcare in India. To moderate this discussion, may I please invite back on stage Kalpana Sharma, the editor of Health, Lifestyle and Education with Times Now Digital. Welcome back, Kalpana. And joining her in this critical conversation is the Group COO of Paras Health, Vineet Aggarwal. Vineet, kindly do join us on stage for what promises to be a fascinating back and forth. We're looking forward to it and the valuable insights into the evolving healthcare landscape in this country. Take it away, Kalpana. The floor is yours.
Thank you, Pooja. So, what makes this discussion important and interesting as well is because for us, you are representing the healthcare, the hospital side of things, something that impacts all of us. So I would like to begin by asking you that, in your entire experience in the healthcare sector, what are your biggest learnings?
I think the biggest learnings have been when I joined healthcare at the beginning. Someone told me that you may not always be able to provide cure, but you can always care. So
Lovely.
I think that has been, these has been the words that have been driving me ever since. And when I look back, medicine is not about technology and doctors alone. It's about humanity. And as long as you are able to look at a person in their most vulnerable moment and tell them, you're not alone, I'm here, that is the biggest work. And that is the privilege that we as healthcare providers are given. So that is the biggest learning for me. Care is at most. Treatment automatically happens. There are always the doctors who provide the treatment. There is supporting staff who provide the support. But as long as you are able to give them a feeling of care and compassion, that is the biggest thing.
You've seen both the diagnostic and hospital side of things. In the past decade, if I ask you that, what are the biggest changes, positive changes that you've seen in the healthcare entire domain, what would that be?
I think the shift has happened in the last 10 years or so. And this will continue to happen in the next 5 to 10 years or so as well. So for far too long, we have been concentrated as a metro-led healthcare setup. But now I think we are moving into areas into tier 2 and tier 3 setups as well. So whether it is diagnostics, whether it is healthcare, I think this expansion into tier 2 and tier 3 cities, bringing it accessible care to where it matters the most, where the gap is the widest, is the biggest shift that we have seen. Second shift, obviously, is that technology has played a very important role, right? And there are two aspects of technology. One is, obviously, we have more than 800 million internet users in India, which makes the patients much more informed and aware about their patient journeys, right? This brings in a lot more accountability for healthcare providers like us to be more consistent and to ensure transparency with the patients and to ensure that we provide the right treatment, obviously, right? The third element also is that there is a lot of personalization also that is happening. Again, thanks to most of the retail folks who have been personalizing the customer experience. So this personalization is also impacting healthcare, where right from the time of ensuring the right treatment and to the time of treatment and the discharge cycles, this all experience has to be personalized now. So I think these are the biggest shifts that I'm seeing in healthcare.
Okay, I'll circle back to something you said about tier 2 and tier 3 cities. So healthcare access and access to, the sort of infrastructure that metros offer. Paras is trying to change that. Can you take us through that journey a bit?
Sure. I think at Paras, our mission and vision always have been that we want to democratize access to healthcare across the entire North India, and especially in the underserved areas in tier 2 and tier 3 cities. The shift is important because it is also a learning moment for us, where when we ventured in tier 2 and tier 3 cities, we realized that problem is not about demand, problem is about latent demand. There is a lot of under recognized uh, demand that is available, and that is largely due to either lack of accessibility to healthcare or lack of awareness. So you will find more and more patients reaching out to healthcare providers like us in tier 2 and tier 3 cities at a very advanced stage. And that is either because they have not been given the right kind of advice, they have not been able to get the advice, or they have not been able to being diagnosed well, right? So this increases the burden on them, which is both emotional and financial burden, and right, and this also increases the complexity for the healthcare providers because now the disease has progressed. So a more and more need for a very strong emergency response, critical care systems beyond just a multi-speciality depth that you bring in. So that's the changing shift in tier 2 and tier 3 cities.
Are you able to, I remember last year at a Hyderabad health concert, we were talking about that, you know, how a lot of doctors do not want to move to tier 2 and tier 3 cities. How are you really, you know, working on that side?
I think rather it's the opposite now. So effectively, if you look at a lot of doctors who belong to that part of the country, they are willing and wanting to go back, provided they have the kind of infrastructure where they can go and provide their services. So as long as we are providing the right infrastructure in these tier 2 and tier 3 cities, I think the dearth of clinicians is no longer there. So they are more than willing to kind of come back to their own region. It's a kind of a feeling serving their own people, right, in that particular area.
That's interesting. So again, something that, you know, obviously at your own end, you're trying, Paras Healthcare is trying to bridge the gaps. But where do you feel that, you know, government in terms of policies or whatever they can contribute, where is that gap that needs to be filled?
I think the problem area has been, one is the investment in public health. So I think that is something that government is already addressing. They are trying to increase the public health spending to 2.5 to 3% of the GDP. Recently, they have also increased the spend on Ayushman Bharat from 7,400 crores to 9,400 crores. So that's one area where government is playing its part. But at the time of policy decisions, I think one thing which will come out as a very clear shift is that without a public-private partnership, I think the speed at which we want to scale, and we should scale to strengthen the healthcare ecosystem in India and build a sustainable ecosystem, that would be difficult without public-private partnerships. Obviously, the government has the reach, but we have the expertise. We have the efficiency, we have the right clinical talent to support patients at large and the public at large. So I think that's the model that should now take shape.
Correct. Both joining hands and making healthcare more affordable and accessible. So again, something that, you know, in terms of technology adoption, where do you see healthcare is right now, where we can go in the next 5 to 10 years?
I think technology is getting absorbed. So there are two facets of technology. One obviously is the clinical side of technology. I think more and more, whether it is the government or whether it is the private players, we are adopting a lot more of clinical technology, whether it is the robotic surgeries, whether it is the radiation therapies, whether it is high-end cardiology programs. So we are adopting technology there, whether it is high-end neurology programs as well, right? At the same point in time, I think there is a need, because technology will no longer be a support, it will be a core enabler. There will be a need of more and more non-clinical side of technology also to come in. So we
have been processes more efficient, you mean?
Yes. So we have been talking in one of our sessions about AI, and I think AI has some real use cases in healthcare, and these are tangible use cases which are beyond just efficiency. They are beyond just optimization of cost without compromising quality, but they are also enabling clinical decision making. They're also helping us standardize more and more clinical protocols. So at Paras Health, we believe that our patients in Kanpur should be able to get the same treatment as our patients in Gurgaon. So Gurgaon is metro, Kanpur is tier 2. So the variability between the clinical treatment should also subside, right? So they should get the similar treatment. So effectively, technology is playing a role in each of these areas, and obviously there is a lot more role that AI can play in clinical decision making as well.
What are you looking forward to, like in the next 5 years, 10 years? How do you see technology changing healthcare? If you have to speak on behalf of Paras.
So in the next 5 to 10 years, I think there will be 3 important areas that technology will bring a shift to. One would be, we so far has been restricting ourselves to episodic treatments of patients. A patient will come with a certain problem. We will treat the patient will get discharged, they will go to their homes, job is done. I think a more integrated approach, which is where technology will now play a part, where care is going beyond the hospital walls, and we are creating a system where right from the time of admission to the time of discharge and post-discharge, there is a continuous engagement with the patient, there is a continuous support that we are providing to the patient throughout their journey from admission to the final line where we say, now I am okay, I can go back to my job, I can work well, I am fine now. So that's the most important shift, and that's the most important role that technology will play on how do you support beyond the hospital walls.
Okay, before we conclude this session, my last question would be, Paras Healthcare is expected to enter an IPO this year. How do you see things changing? And, where is that balance between business, healthcare, delivery?
See, IPO certainly accelerates your capital, right? And that is where the edge comes, where you say, okay, how do I use this capital now? So typically, any healthcare provider will use this capital for creating a robust infrastructure, for attracting top talent, and for ensuring that the right patient care ecosystem is built. Patient experience obviously is the #1 priority for everyone. So with this kind of capital infrastructure flowing in, I think that would be the first and the foremost thing, because the question will not be about how fast or where you are expanding. It is about how you are building a sustainable healthcare ecosystem. So that's where this kind of capital should be utilized, and that's how the capital will be utilized in future.
We are looking forward to that, and thank you so much for joining us today.
Thank you.
Thank you so much, Kalpana and Vineet. And Kalpana, I ask that you please present our guests with the token of our appreciation, our way of saying thank you from the ETnow.in team. I think aside from all of the strategic insights around building a sustainable healthcare ecosystem, just the selflessness that's required to become a physician. The first thing that Vineet said was that while you can't always provide a cure, you can always care. And I think that statement in and of itself deserves a round of applause, please, ladies and gentlemen, for Vineet Aggarwal, COO of Paras Healthcare. Thank you so much. Thank you, Vineet, and thank you, Kalpana. All right.